Uganda, located in the Great Lakes region of the East African Rift Valley, faces significant public health threats, from persistent diseases like HIV and tuberculosis to deadly outbreak pathogens like Ebola and Marburg. To combat these, a critical partnership has evolved between Africa PGI and Uganda's Central Public Health Laboratory. Based within Uganda's National Health Laboratory and Diagnostic Services in Kampala, CPHL are integrating advanced pathogen genomic sequencing into the nation's health system, utilizing powerful technology from Africa PGI to track outbreaks and improve disease control.
This lab started way back in 2021. It was initially established to support HIV genotyping, meaning that we could support informing change of treatment by looking at the virus to see whether it has developed resistance or not. And that's when we walk into the COVID era. And then we got hit by Ebola in 2022, and the lab had the role of knowing what is going on with this strain. First, I want to appreciate that Africa PGI has been very, very supportive from the word go, from the inception, and we took a very phased approach based on what we can do and what we can output. In terms of capacity building, training, they have really done a good job. In terms of infrastructure, some of the equipment here are donated through Africa CDC. And we see that the lab is at the level where it can basically do the best lab processes and output, because currently we're doing around 2,000 samples in a month.
This is a national reference lab, and we support highly specialized testing for public health functions. So we do reference testing for diagnostics, but we also support outbreak and emergency investigations. So we are part of the Africa PGI network since the COVID time, and we have worked together to build capacity for outbreak and emergency investigations. Since the end of the COVID pandemic, we have supported a number of outbreaks here in Uganda, including 2 Ebola outbreaks. We have supported cholera outbreaks and several others. We have worked with Africa PGI through different initiatives. One of the success we've had with the genomics lab is to integrate it in all outbreaks that we have had of recent. One good example is the recent Ebola outbreak in Uganda. We were able to sequence and release the genome of the index case in a space of less than 48 hours. This is unprecedented, even when you have to use the high-end labs in Europe and in the US. Particularly for the genomics lab, we have benefited significantly from the Africa PGI. We've acquired a sequencing platform, the NextSeq and the MySeq, and other auxiliary equipment, including the automated library preparation equipment, which really speeds up our work in the lab.
So in here, we basically sequence pathogens. The laboratory's capacity building has mainly based on mentorship and trainings, so that supporting partners like Africa CDC, ASLM. So at the very start, they sent a team of lab techs to NICD to help build capacity when it came to SARS-CoV-2 sequencing. When it comes to an outbreak, we are able to actually link the current strain to maybe the existing strains. If there've been previous outbreaks, you're able maybe to identify the index case, so you're able to inform public health and be able to curb the spreading of any pathogen during an outbreak.
Actually, the biggest achievement of all from the Africa PGI collaborations is building the networks for the member states, especially in the public health space. Previously, we've always had collaborations with all rest of the world except ourselves. If you have a patient with a condition and you're able to effectively diagnose, that is 70% to solving that problem. And that's what this lab would do. That's what this lab does. Accurate and timely diagnosis that is accessible.
The genomic sequencing at CPHL represents the new front line of disease defense. This work, however, does not exist in a vacuum. It's powerfully complemented by the decades of specialized virology work at its partner institute, UVRI, the Uganda Virus Research Institute. Founded in 1936, UVRI has a long storied history as a global center for studying the world's most dangerous viruses, from yellow fever to Ebola. While CPHL casts a wide net across bacterial and viral threats for national public health, UVRI provides the deep foundational expertise on the viruses themselves. Together, they complete a chain of defense, from deep historical understanding to cutting-edge genetic tracking, who both have benefited from the expertise, training, and infrastructure support from Africa PGI.
So the Uganda Virus Research Institute is a very historical institution in Uganda under the Ministry of Health, which has done quite a lot of research in various pathogens that cause various diseases in the country. During the pandemic, much as the UVRI was doing the reference testing, the numbers were really overwhelming. And this was quite a bit of a challenge. So when the Africa PGI came in with a lot of support to enable other facilities in the country to have capacity for diagnostics as well as genomics, this really gave us at least some breathing space in as far as the response was concerned.
Over the years, the Institute really contributed in discovery of many viruses. Some are very well known. Zika virus, West Nile, as you have heard, chikungunya, onyong-nyong. Many viruses have local names because they were discovered here. So we are very proud of the area history of the Institute. But the COVID really opened up Africa because COVID was all over. We said, let's work together. And I thank Africa CDC, African Society for Lab Medicine, which brought us together under PGI to work together to address COVID. They provided a lot of support in terms of reagent, capacity building, and networking. We know most of the people who have been working on COVID through these networks, and PGI is one of those. I think there's been a lot of investment in genomics, but we need to do more. I think with PGI, let's expand our capacity, let's bring more technology, but also analysis, so that we have scientists who are trained, who can use genomics, and who can analyze and contribute to the global picture.